Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Sandy Washburn. She's VP of Operations at Compass Health Systems. Welcome, Sandy.
Welcome. Thank you so much for having me.
Yeah, excited for this discussion. We're obviously here at the eClinicalWorks annual conference. Lots of things to talk about. We're going to be talking rev cycle, such an important topic for every organization. But before we go there, tell us a little bit about yourself and Compass Health Systems.
I've been with Compass Health for 30 years now.
Wow.
We've been on eClinicalWorks for over 10, could be a few more years than that. We currently are in 12 different states. We have 120 providers. We service 80 nursing homes.
Wow.
We have 9 brick and mortar offices, but do pretty much right now primarily telehealth.
Mm-hmm.
We service about 100 other kinds of facilities, detox, residential, PHP, and integrate primary care with our behavioral health.
Wow, that's amazing, the breadth that you have and that ECW is able to span that. That's pretty awesome. But, as I said, I want to talk about RCM. Why is RCM so important to the success of your organization?
RCM assists us in establishing really efficient workflows. Just the volume and the complexity of our particular practice. We have 13 different tax ID numbers and all these different group NPI overrides. So it's really been very valuable to have someone help us establish those kinds of workflows.
Interesting. And how have RCM and claims and denials, have they become more challenging over time?
Insurances change their rules every day. It is a big challenge, especially also in the behavioral health field, because we are not billing the medical carrier. We have to bill usually an intermediary.
Okay.
So it's been extremely helpful getting all of those kinds of settings and groups in the computer so that we could bill, we could run reports on large groups of claims and for facilities or for insurances. So it's been very helpful.
And I imagine it's very different to bill, an addiction recovery center versus a behavioral health versus a clinic, right?
Correct, because we have to use all the different kinds of places of service and different kinds of CPT codes, whether they're community behavioral health codes or they're regular E&M codes or procedure codes, HCPCS codes, we use them all.
Well, and that's probably a staffing challenge as well,
Absolutely.
Right? Because, does the staff know how to do all of those? I imagine, is that one of the challenges that you faced? You chose to go with ECW's RCM consulting services. Talk to us about why you chose to move to them rather than doing it yourself.
We chose to move to them. Pretty much we were on ECW for about 5 years, and we needed a cleanup. There was just so much, sorry to say, garbage there that we couldn't handle and didn't really know what to do with. Your secondaries that don't ever get paid and just different kinds of things like that, your patient problems, denial issues, appeal issues, and just trying to get all of that situated into good workflows and we also are using the work queues and we use a lot of the different modules and all of the different areas of the RCM module. Denial management and the CAS code configuration has been very helpful with our denials.
Yeah, I think it's interesting. It's almost like technical debt that we're very familiar with. Over time, you build up this technical debt. It's almost like RCM debt that builds up over time.
Correct. You have bad write-off. We do a lot of indigent work at the hospitals. And eventually you need to write it off. You need to decide to send it to collections or what do you do with that? So they've assisted us in trying to establish some really great ideas, and it's very good brainstorming because you really get to work with someone who knows your practice.
Interesting. So tell me more about the experience working with ECW's RCM consulting services. What have been some of the benefits and the outcomes of working with them?
I love the idea that I can establish a rapport with someone and email them, hey, I'm having issues with something. What do you suggest? The problem that we have, the challenges that we face is nobody has time. And you don't have time, I don't have time, no one has time. So to place a support call and then have to wait for someone to call you back, you're already on to your next thing, next meeting, and you just want to be able to communicate some of your challenges to someone, and they're going to get back with you and email you or set up a call with you. And it's really a wonderful relationship that we have.
Interesting. You probably benefit too because ECW does this for so many practices. If they don't know the answer, they can go to someone else.
I've given them some great challenges though, and they've succeeded in really helping us solve them.
That's awesome.
Yeah.
How have your leadership and your staff kind of reacted to this change? Obviously it's a big choice because RCM is, and the revenue you generate from it is so important to the success of your organization. How have your leadership and the other staff reacted to it?
The leadership is very positive about the consulting services. They've seen a big change in our efficiency and in our AR days. We share a lot of information with the doctors about length of stay and productivity and revenue generating services that they could add on. So it really has been a great asset to be able to work with the RCM product and the people, and they help us really be more efficient.
Interesting. And where do you see RCM headed? What are you looking to do next? What do you see kind of happening with the industry? As you said, it changes every day. What else are you looking forward to?
I was really happy to see some of the advances that are coming out.
Which ones were the most interesting to you?
The whole appeals, automated appeals, that was perfect. And we have a lot of little insurance companies, but big volume. So they don't send EOBs through the ERA. So product, that transforming the EOB into the ERA to have it auto post, that's a phenomenal asset for us because I don't need someone to waste 8 hours keying in information for a 20-page EOB.
Interesting. I was excited about the documentation improvement, essentially aspects that kind of cue the provider to make sure
yes, absolutely.
you do the right one so the billing works on the back end.
Yes, I love that. Yeah.
That's awesome.
There's a lot of, there were a lot of great things that we were shown.
That's awesome. Well, Sandy, I appreciate you taking time to sit down and talk with us about your experience working with the RCM consulting services and RCM in general. It's such an important area, to make sure that your organization is successful. So I appreciate you taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Sandy.
Thank you so much for the opportunity.